Hey Mavs, as you hopefully read in our Safe Together, Strong Together interim report, COVID-19 testing and contact tracing is a cornerstone of our COVID response and returning to in-person learning.
John, that's right. And for months we have worked alongside some of CMU's incredible faculty members to devise an approach that will help mitigate the spread of COVID-19 on campus. Last week we shared details on our testing protocols, and this week we want to share more about our plans for contact tracing, which are being led by faculty members who will focus on limiting COVID-19 spread and adhering to the HIPAA guidelines to protect the privacy of those who have tested positive while locating and informing anyone who may have been in close contact and have a risk of possible exposure.
Dr. Bronson, thank you for your leadership.
You're welcome, John. And now let's introduce everyone to the team. Dr. Megan Sherbino from the Department of Biological Sciences, Christy Emerson from the Mesa School of Nursing, Dr. Kristen Human from the Department of Kinesiology, and Michael Hughes, who will be staff support for our contact tracing team.
Take it away, team.
Thanks, John and Dr. Bronson. We're excited to be helping with this critical component of our Safe Together, Strong Together campus plan. I'm joined today by the other members of our contact tracing team that you just introduced. Christy, do you want to chat briefly about what contact tracing is?
Absolutely. Contact tracing is key to slowing the spread of COVID-19. Contact tracing has been used by health departments for decades as a strategy to prevent the spread of infectious disease, and it involves identifying people who have an infectious disease and people who they may come in contact with. This can help interrupt the spread of diseases, such as COVID-19, by asking those with COVID-19 to self-isolate and asking their contacts to self-quarantine. By staying home, confirmed COVID-19 cases and their contacts reduce the number of people they interact with, which decreases the potential spread of disease to others.
Christy, that's great information. It's important for people to understand the difference between quarantine and isolation as well. Quarantine is used any time that someone has possibly been exposed to someone with symptoms or who has tested positive for COVID-19, while isolation is used for someone who has symptoms or has already tested positive. Megan, what's the science behind contact tracing? Why do we do it?
Sure, Kristen. SARS-CoV-2 is a virus spread by respiratory droplets, meaning that an infected person breathes it out. If a person has COVID-19 or has been in close contact with somebody with COVID-19, they can spread the virus by breathing, speaking, or coughing nearby other people. Therefore, if people who have the virus or are likely to have the virus self-isolate or quarantine at home for about 2 weeks, they are much less likely to spread the virus to other people. If people do a good job of self-isolating or quarantining as instructed by a contact tracer, then it is more likely that we'll be able to keep the campus as healthy as possible and open to in-person classes.
Megan, who will be doing it and how are they going to be trained?
We are assembling an excellent team of contact tracers from the CMU community. Many of these people bring their knowledge and skills in patient and student care they already have to the team, and we are providing additional training incorporating the curricula from the foremost experts in public health and infectious disease in the country. Our contact tracers are trained on issues specific to COVID-19 and how to carefully deal with private and confidential health information, protecting our privacy while bettering the health of the CMU community.
Megan, thanks for the update on how we're going to keep the campus safe. Christy, how will this all work?
A case is identified when an individual tests positive for COVID-19, either through testing completed on campus or through testing completed with a healthcare provider. Cases will receive notification that they have had a positive through the campus app, Scout, as well as through email. A CMU contact tracer will then contact the individual to discuss next steps, including the need to self-isolate. It is important to identify individuals who are in close contact with the positive case. Contact tracers will reach out to those individuals to let them know they may have been exposed. The name of the positive case will not be revealed to those who have been exposed, even if they ask. Contacts will be asked to schedule a COVID-19 test and to monitor for symptoms while in self-quarantine to help prevent additional exposure.
So, we all need to do our part to answer our phones this fall or to check our voicemail to return these calls, right?
Yes, it will be very important that every member of the MAVLI is responsive to the contact tracers so that we can reduce the spread on campus.
That was a great synopsis. Thank you, Megan and Christy. This is all very helpful information for all of us. It's important to remember that you will only be contacted if you had direct contact as defined by the CDC with a person showing symptoms or who has tested positive for COVID-19. These measures are meant to keep CMU students, faculty, and staff safe, and we all play a role in protecting the Mavely. And remember, for the most up-to-date information on COVID-19, visit coloradomesa.edu/COVID-19. Stay safe, Mavs.